Hello everyone, in this video we are going to talk about juvenile idiopathic arthritis, especially the systemic onset type, in a visual mnemonic to make it easy to memorize the cardinal sign of this disease. Let's start. Jennifer was a girl below 16 years old.
Hey!
The name of Jennifer should make you remember the juvenile idiopathic arthritis, which is our disease, juvenile. Remember Jennifer by juvenile. And her age, which is below 16 years old, which should make you remember that the age of the disease is below 16 years old, and it's one of the most important diagnostic criteria of the juvenile rheumatic arthritis. Jennifer woke up in the morning one day and she was hungry, so she looked up in the breakfast table. She found salmon fish and she found hot pepper. She thought, salmon? I don't like salmon. The salmon should make you remember the salmon skin rash that present in juvenile idiopathic arthritis, which is one of the criteria for diagnosis of systemic onset juvenile idiopathic arthritis. It is evanescent erythematous rash that appears and disappears. So she thought that I should eat the hot pepper.
Uh-oh.
Oh, the hot pepper should make you remember the fever. The hot fever, which is called in this disease quotidian fever. Quotidian fever is a spiking fever which is rises once a day and then returns to the baseline. And it's about more than 2 weeks duration, and it is one of the cardinal signs for diagnosis of the disease.
No.
When she ate the hot pepper, the tears started pouring from her poor eyes, and her eyes becomes red. Oh, poor baby, poor baby. Her red eyes should make you remember the uveitis, which is complication of the juvenile idiopathic arthritis, especially in positive ANA type of patients. And it may occur in asymptomatic patients, so slit lamp examination is essential to detect that. It also occurs as in extra-articular manifestations in oligoarticular juvenile idiopathic arthritis patients. Jennifer started to run lostly while she didn't see anything, and she was screaming and crying, "Mama, Mama!" She was crying and crying loudly, and she wasn't seeing anything, so she fell down.
Uh-oh.
And she hurted her knees. The hurt knees should make you remember the arthritis, which is one more cardinal sign for the diagnosis of juvenile idiopathic arthritis. Arthritis with swelling or effusion and pain, tenderness, hotness, or limitation of the movement. She went to her mother, and her mother has her way of soothing her, so she told her, "Oh, baby, you are overreacting." She was crying and crying and crying and crying and screaming, and her mother told her, "You are overreacting." The overreacting should make you remember the Kebner phenomena, which is cutaneous hypersensitivity to superficial trauma, occurs with systemic onset juvenile idiopathic arthritis. Moreover, she told her, "You are overreacting and you will be late for the school." Late should make you remember by the L with the leukocytosis that happen in the juvenile idiopathic arthritis, and the A should make you remember the anemia, and the T should make you remember the thrombocytosis. The E should make you remember the increased ESR and acute phase reacting, including the CRP. By one way or another, these stupid words could actually soothe Jennifer. I don't know why. So she started to sing a song which is more or less some actually health. Of course it's health. What she could be singing. The words of health should make you remember by the H, the hepatosplenomegaly, by the L, the lymphadenopathy, by the S, the serositis that occur in juvenile idiopathic arthritis, the systemic onset type. And this is the story of Jennifer. Let's revise again. Juvenile idiopathic arthritis occurs in patients below 16 years old. Salmon skin rash, one of the characteristic cardinal signs that occurs in systemic onset juvenile idiopathic arthritis, which is evanescence and erythematous. The fever, which we call in this disease quotidian fever, that spikes up to 39 once a day and then returns to the baseline for more than 2 weeks duration. One of the complications that could happen uveitis could occur asymptomatically, so slit limb examination is a must. Arthritis in more than one joint, swelling or effusion with pain, tenderness, hotness, or limitation of movement. Kapner phenomena, which is cutaneous hypersensitivity of superficial trauma, can also occur in systemic onset juvenile idiopathic arthritis. The investigations include leukocytosis, anemia, thrombocytosis, increased ESR, and CRP. Some signs we could see in patients with systemic onset juvenile arthritis, hepatosplenomegaly, lymphadenopathy, and serositis. And by that, we finished the story of Jennifer and the juvenile idiopathic arthritis.